All right, hello everyone. My name is Michael Berger and I'm here with Beth Perkins, and we're going to be doing a presentation on pulmonary hypertension.
So what is it? It's a type of high blood pressure. Normally, blood pressure should be 25 to 10, whereas the pulmonary arterial pressure exceeds 40/20 with pulmonary hypertension. This is going to lead to atherosclerosis in the blood vessels of the lungs and affect the lungs in the right side of the heart. So the resistance to the blood flow in the lungs will eventually lead to failure of the right ventricle that will need to work too hard to get the blood to the lungs.
And this here is just an illustration of what Beth just described. So you can see in the heart with pulmonary hypertension, those ventricles are a lot bigger in volume, and also there's a lot of hypertrophy in the muscles. So eventually those ventricles are just going to fail from being overworked.
So how does a person get it? You could potentially get this disease secondary to the pulmonary arterial hypertension. So this is a disease that affects a small percentage of the population. It does have an unknown cause. Current theories include gene mutation, drugs, connective tissue disorders, or infection. Also, through a left side heart disease might cause this, through disease to the mitral or aortic valves, with stenosis or regurgitation and failure of the left ventricle. You may also see this with lung disease, obstructive or restrictive, and sleep apnea with long-term exposure to higher altitudes in people already at risk as well. You may also see this with a pulmonary embolus or a person with sickle cell anemia. The sickled red blood cells get stuck in the pulmonary arteries and veins, and you may see this most in African American citizens.
All right, so here's some risk factors. One of the big risk factors is being overweight, just because the heart just has to work harder to get the blood through the lungs. Also, having a family history of the disease, or having a family history of any kind of heart disease is a big risk factor. And then having any of the diseases that Beth mentioned on the previous slide, such as that sickle cell anemia or the coronary artery disease, anything like that. Also, illegal drug use, such as the amphetamines, like Beth mentioned, can be a risk factor for this disease.
How does it affect a person? So symptoms include shortness of breath. Initially, they'll notice this only during exercise, but as the disease progresses, they'll notice it at rest as well. They may be experiencing fatigue, dizziness or fainting spells, chest pressure or pain, ankle and leg edema. Sometimes this presents in the abdomen as well as the disease progresses, and they may also notice a racing pulse or heart palpitations. Other potential complications associated with this disease and how it affects a person includes cor pulmonale. So this is when the right side heart enlargement leads to heart failure. The thickening of those ventricle walls are used to compensate for the extra work that needs to be done to pump blood through the narrowed or blocked arteries, but eventually the heart does fail due to that extra strain. They may also have blood clots. This pulmonary hypertension causes these patients to be at a more high risk for developing these clots in the smaller arteries around the lungs, which are increasingly at higher risk because they are narrowed and blocked. You may also see arrhythmias, which is just an abnormal heartbeat, and bleeding in the lung tissue leading to coughing up blood, which is the hemoptysis.
The prevalence of this disease isn't known exactly, just because it's a hard disease to diagnose, and a lot of times people have other diseases along with this disease, and this just isn't one that is a priority. So there's 200,000 hospitalizations per year worldwide for this disease, and then 15,000 deaths are attributed to it every year. But it's believed that there is probably a lot more cases than this, just because of how much of it goes undiagnosed.
Medications used to treat pulmonary hypertension include calcium channel blockers to relax the blood vessels, phosphodiesterase 5 inhibitors, which also helps to relax those blood vessels, digoxin, which strengthens the heart, and diuretic to prevent the fluid retention, as well as supplementary oxygen.
So, as I mentioned before, this disease is hard to diagnose. So, a lot of times there's not any kind of early recognition of the disease. So, the main test to diagnose it is a echocardiogram or maybe a stress echocardiogram. A chest x-ray, which is shown in the picture here, which can show enlargement of the right ventricle or the pulmonary arteries. And then a right heart catheterization is the gold standard for diagnosing this. Other tests include an MRI or a CT scan, pulmonary function tests, or the VQ scan, which is that ventilation perfusion scan. So as far as studies and research relating to physical therapy, we found this study titled Exercise Training in Participants with Pulmonary Arterial Hypertension, a case report. So this study wasn't actually done on pulmonary hypertension in general, just the pulmonary arterial hypertension, which is the really rare form that Beth mentioned earlier. So there were two patients in this case report, a 50-year-old male and a 54-year-old female with a history of the disease. They participated in an exercise program 3 times per week for 6 weeks using a cycle ergometer at 50 to 80% of their max workload. And both of them made substantial improvements in their oxygen consumption and their workload at the anaerobic threshold, and there were no adverse effects. So an exercise program of this nature is very helpful for people with this disease.
We talked earlier about therapy, medication therapy for pulmonary hypertension. I found an article on current therapy. While there is an inability to cure the disease, the current approach includes activity limitation, long-term anticoagulation, and the vasodilator therapy, which we mentioned with the calcium channel blockers. This article found that with a better understanding of the pathogenesis, there was a change in focus from the chronic vasodilation therapy, such as the calcium channel blockers, to evaluate agents to reverse the proliferation of those pulmonary vascular cells, which would result in the regression of the hypertrophy and remodeling of these cells. Intravenous epoprostenol is now the current gold standard for long-term treatment in severe cases of pulmonary hypertension. It's used to improve the exercise capacity. However, it is not a standalone treatment. There are other therapies that are involved, such as the exercise therapy that we discussed in that previous article. And this drug does have many adverse effects. Some are mild, but many are very severe. There was a long list of adverse effects.
And these are our references. Thanks for listening, guys.